Hello, everyone. My name is Angie Cook, and I am with the Minnesota Department of Health Center for Emergency Preparedness and Response. And I'm also with the State Emergency Operations Center during our COVID-19 pandemic response. And I have the privilege of speaking with you all today regarding our long-term testing plan template. We'll be going through the template itself. We'll be talking through the various different resources that you'll have available in order to inform your testing plan. We'll talk about why it's important, what are the different pieces of information that will be needed, and just sharing some best practices on how to best implement your testing plan. Also, just note that part of this webinar allows you to get a feel for what it would be like to complete your testing plan, and therefore we're going to be toggling back and forth between a PowerPoint presentation and the documents that we will be reviewing. So let's go ahead and get started. First and foremost, this project, this effort is a collaboration between the State Emergency Operations Center, the SEOC, and all of the healthcare coalitions statewide, all 8 of them. And it is important for you to know this information for multiple reasons. One, because you can rest assured that the development of the testing plan was done with preparedness experts across the state that know their communities, that know the resources and capacities and capabilities that you have as long-term care providers when it comes to developing a testing plan. But it also allows you to have a connection with someone after this webinar when you're sitting down and you're writing your plan out, knowing that you can always reach out to your coalition leaders for any additional guidance that may be needed. They are your preparedness experts, and they have additional resources that would help inform the development of your plan, but also it allows you to connect with other peers that are also developing their plans at this time. So the 2 documents that we're going to be reviewing are the guidance document and the testing plan template itself. They were developed to go together, to go hand in hand. The guidance document informs the plan template. It allows us to dig a little deeper on thinking through some scenarios, thinking about probing questions, really looking at ways to dig deeper into your plan and make it as fluid yet as robust as possible to ensure that we meet all of the resources and capabilities that you have within your facility to inform the testing plan implementation. It also allows us to think through, as I mentioned, the scenarios and probing questions. So we do put information in there specific to, like, what if something were to happen, or what if you didn't have these resources? What if you ran into a particular barrier? And therefore allows you to have some discussion points that you're going to want to come back with your administration, your decision makers, to talk through how you would address such concerns. The template itself was developed to be an easy copy and paste format document that you could fill in your information based on the different sections that you're working on, and then intersect it, if you will, with your current existing emergency operation plan, your EOP. This plan is not meant to be a standalone. It is meant to be a part of a bigger picture, part of that EOP that you have for your facility. We know you have a level of preparedness, of a level of emergency operation plan in place just from being a long-term care facility. And you're going to find the importance of being able to integrate between the two, because other plans and policies will inform your testing plan and vice versa. The plan itself was also developed to be very flexible. It is so important that we provide, at a state level, we provide a baseline, a framework for you to work off of. But the nitty gritty, getting down into the weeds of your plan really become flourished, if you will, when you take the information and you make it your own. So we give you a starting point, a launching point, if you will, but it really takes that effort from you and your administrators to take the necessary steps needed to be able to complete it with the details that is being requested. These documents, just to be clear, because we do get this question a lot, these documents are not regulated documents. In other words, you are not going to be graded on or cited on. You're not going to be asked to show the template, and if it doesn't have a particular section, be penalized for it. Now, the expectation is that you have a testing plan, especially now during our COVID pandemic. It is so vital that you have a plan in place, because we know that testing is not a one and done deal. This is an ongoing effort. And so we want to ensure that everyone is well equipped and well prepared for now and for the remainder of the COVID response. However, we know that everyone comes with different levels of preparedness and different levels of response readiness. So that's why it's really important that you take this as a framework, the foundation that you can then go and move forward with. So, and I just like to reiterate that often throughout this time, because I want to make sure that I'm making the point that you will not be penalized if it's not exactly the way this template is designed. Many of you have plans in place or have started a drafting of your testing plan, and that's fantastic. I encourage you to use our document and cross-reference and see if there's anything that's missing. If you haven't started one, then this will be a great first step. Okay, now that we've kind of talked about a little bit of what we're going to be walking through over the next hour here, let's talk about the different sections of this plan. So this plan starts out very basic, if you will, as with any other preparedness and response plan. You have a purpose, background, assumptions sections. These are 3 different sections that really set the tone for your plan. It gives the foundation of why this is important, who needs to be involved, what are some of the baseline actions that I need to be taking, what are some of the expectations of me as a long-term care administrator and of my staff and of my facility in regards to testing. And then the 4th section is that of a threat assessment. As we know, with any plan, we have to ensure that there's an assessment in place to understand where on the spectrum of testing, for example, do we fall from a threat perspective? Are we at high threat or low threat, high risk or low risk? And so we'll talk about that later on when we get into that section. There's an activation section. You know, what are the triggers and thresholds of activation? Who's responsible to activate the plan? Who are the teams that will be activated? Operational considerations starts to get into the nuts and bolts of the testing plan. You know, what's the process that we're going to be taking? What are the models that we're going to be choosing? What is the direction and vision of how we would roll out testing? Testing requirements. So this really ties you back to guidance, infectious prevention guidance when it comes to any infectious disease, and then more in particular for this response COVID-19. We go into the testing approach and really looking at, you know, what direction we're going to be taking. How does that differ between our residents and our staff, et cetera? Then we get into the implementation of it on the day of testing. What are some things we want to consider? What are the what ifs that we might run into from a barrier perspective? And then, of course, with every plan, there's a plan maintenance section, and that really just ensures that you're doing your due diligence and reviewing the information. And so you might be listening already and thinking, "Oh my goodness, Angie, you've got to be kidding me. We're just starting this out, and this feels so overwhelming." And I have to tell you that in every session, I get someone that has been replying back and saying that yes, it initially may feel overwhelming, but as they dig into the documentation and start to fill it out for themselves, they feel that it is well laid out and it's very intuitive. And that to me is bonus. That's a win-win for everybody. And that's really what we try to aim here to do, is make this as intuitive as possible and as a easy lift for you to really focus on the key components that you need to be thinking about in order for implementing testing. So before we toggle back or toggle to the documents themselves, let's talk a little bit about the first three sections. Purpose and background being the first two. So again, as I said, it sets the stage. Here you're going to want to be thinking about, how does it integrate into my EOP? What are some of the other plans and policies that I'm going to want to be mindful of that might inform my testing, whether it's cohorting or isolation, whether it's your continuity plan for staffing shortages. A huge plan right now that we've been pushing out some training as well, but it's so important for you to be thinking about testing and staffing as hand in hand, because they do influence and impact each other. And you don't want to come to the point where you have your testing results and you have positive staff and you don't have a plan to address how you're going to manage while those staff are home recuperating. Thinking about PPE and what are some of the plans that inform testing when it comes to PPE? What are the regulations? What are the requirements? Do you have a training plan for PPE? If you have to bring in more staff, how are you going to train them to ensure safety for testing and just in general for being within the facility? Great. And then assumptions, the assumption section, it overlaps a little bit with what I've already spoken about regarding the plans and the processes and policies. But I do want to highlight the last two, and that is the administration input and engagement. It is so vital that from day one of when you develop your testing plan, that your administrators, your decision makers are involved in the discussions, in the brainstorming of how you would go about in completing the plan, and more importantly, implementing testing on a regular basis. And then being the decision makers to explore responses to the what ifs, or the barriers that you will encounter. And so it's so important to have them from the beginning to the end, the full spectrum, the full cycle of development of the plan. And then lastly is understanding the positive and negative results. And this really talks to guidance, understanding what the guidance is from MDH and from CDC, and what does the guidance tell you in regards to the current disease. So COVID, for instance, what does it tell you about what to do when you have negative and positive results? What are the precautions you're going to need to be taking? What are the actions that you're going to be needing to be taking in your facility? So those are some of the assumptions that we want to run through. Great. So we're going to go ahead and toggle over to our documents. And what you're going to find is that I have two documents. So on my left-hand side, I have the guidance document, and on my right-hand side, I have the template itself. If I were you, I would print these out. I would have them side by side and walk through them together so that I can easily read the guidance as I'm filling out the template. So the guidance currently, the first kind of introduction, if you will, is very specific to the COVID response on how and why it's relevant to have a testing plan in place as we are working and responding through our COVID pandemic here. And so it really just set the stage on how this came about and who was involved, et cetera. But more importantly, it sets the message, the tone around you are not alone. We are all in this together. This is a statewide response. There are many different resources for you to leverage, and we want to ensure that you fully maximize and are aware of all of these resources. And so we do list those resources here as far as what's available through the SAOC. We do have some links as well that relate back to resources on the website. But again, just really setting that message for you all. Great, so I'm going to go ahead and just scroll down and get myself ready on my template. So on the template side, on the right-hand side, you're going to see that when I hover over things, some things might highlight. And that's really the areas where you're going to be updating your information. So for instance, here, it's already telling me I need to do something, and it's just entering the name of my facility. So that, again, it's an easy cut and paste over into your EOP, or maybe just a straight attachment to your EOP, which would probably be the easiest and most ideal, but whatever is best for your structure. Okay, and then you have the date, and this is when your facility has approved the testing plan itself. All right, great. So we're going to go ahead and scroll on down. And we're going to start out with our purpose. So you see on the right-hand side, purpose on our template, and it's literally one sentence. On the guidance side, there's more information. It's more in depth, and that is what you're going to experience as you work through this process with the template development. Okay, background, we're going to dig a little deeper into the background. So the background, again, the first part is pretty standard. I highly recommend, read what we've written here as our recommendation of what you would want to have in your template. Many of you will just leave it as is and agree with what we've written. Some of you will, change it and edit and enhance it further. Some of you might scale back, whatever is appropriate for your facility. But everyone is asked to include the information as being requested within these brackets. So you can see that there's brackets and it's also highlighted. And so we're going to go ahead, and here it says enter a list of other related plans and protocols. And that's what I was talking about earlier in the presentation, is during this background, in this background section, you're going to want to be thinking about in your own EOPs, what are the plans, and think about the name of your plans that are going to inform or intersect with this testing plan. We already talked about isolation and staffing. What about communications plan? What about your staff leave policy? Are those plans going to inform your testing plan, or does your testing plan inform those plans? Again, thinking about what is that connection, what is the bridge, and is there a bridge? Because if there's any bridge between any plans, you want to ensure those plans are documented here. So when this plan is implemented and activated during a response, you know exactly your expectations of what plans to review as well. Okay, great. So we're going to move on to assumptions. And on the right-hand side, you see the section assumptions, and you don't see it on the left. And the only reason why that is because this is pretty much standard information. That's not really going to take any action on your part. However, I highly recommend, as always, to read through it thoroughly and ensure that you are in agreement with what it says. It has already been structured and filtered for you specific to infectious diseases, and the expectations that we would have as preparedness experts on any facility when it comes to developing a testing plan. And so that's why we feel that you most likely will not even touch this section, but we want you to be aware of what those expectations, those assumptions are. Okay, great. So we're going to move on, and we're going to move over to the guidance side. And you'll see that I have some additional instructions on how to use this, but we're going to jump into the pandemic epidemic threat assessment section. Now, as I mentioned during the PowerPoint slide, every plan has a threat assessment in regards to, where do you as a facility fall with the level of threat that would impact the plan that we're discussing, whatever plan it might be. And many of you, hopefully all of you, have gone through a hazard vulnerability analysis where you, an HVA, where you have done an assessment on what are the threats within your community that would impact or disrupt your services as part of your facility, whether it's, electrical outage, whether it's flooding, etc. Those HVAs are assessments, and that's what we would do here too for your testing plan. Now, on the left-hand side, you're going to see some information specific to COVID, and you're going to find that throughout the whole document. That is the beauty of this guidance, is that it allows us to personalize the instructions and recommendations based on the current disaster, the current response that we're in. So in the future, if and when we have another infectious disease response, we would do very similar. We would develop a guidance in relation to that response, and then you would go use that guidance and update your testing plan. And so that way you allow for that level of flexibility. Now, what I've said here in the guidance section is that for the purposes of the COVID response, based on the MDH guidance, all long-term care facilities are at high risk and therefore should move forward with testing. So that assessment allows you to determine, do I need to move towards implementing my plan and conducting testing in my facility? Well, for COVID, we have determined, based on the disease and all the unknowns and the level of spread, that everyone is at high risk. And because of that, this threat assessment section doesn't really need to be touched at this point. That being said, we have an area here where it's highlighted for you to add information, but I recommend you do that after the fact. So until guidance has changed and we are no longer all at high risk, then we'll want to address how to go about with the threat assessment. Or post-COVID, and I promise we will get past post-COVID. There will be a time when that happens. But post-COVID, you'll definitely want to come back and complete a framework for your threat assessment so that it's ready to go when the next infectious disease response occurs. And we have indicated here that your regional healthcare preparedness coordinators, your RHPCs, they're the leaders of your coalition, the staff members of your coalition. They are going to be your assets. They're going to be your point of contacts when it comes to working on that threat assessment. So more to come later on that. So at this point, we're going to move on. All right, activation. Now, every plan has an activation stage. And so really here we're looking at what is going to trigger the activation of your plan. Is it the declaration at a state level? Is it a community-wide spread and you need to activate sooner rather than later? Who's going to make that decision, again, at the state level or at the facility level? Thinking about the role of the staff that's going to be responsible to activate the plan. And that is the key thing here that you're going to update. So you see right here where I've highlighted that we need to enter in this section who will be the appointing authority for activating this plan, because whoever is responsible will then be appointing a testing team lead. So what I would recommend is that you would, as it says in the guidance, this typically is your facility administrator or a director of nursing. So, I would put in, facility administrator and leave the title, the position title as part of your entry here, because we know of a high level of staff turnover. And so we would put that information, but then, let's say as a scenario, my facility administrator says, all right, we are activating this testing plan and I'm appointing you, Angie Cuck, to implement the plan. And I say, great, where do I even start? And that is where you can then go to our attachment, which is attachment 1, and hand this over and tell the testing team lead, here's a starting point. So, okay, so I would, if I'm appointed, I would go ahead and put my name here, and I would just start to look at this and think about what is the scope of information that I'm going to be responsible for implementing this plan. It looks like I'm going to need a ordering provider. It looks like I'm going to need to think about the swabbing staff, if I'm going to need training for swabbing staff. And granted, I might be like, I have no idea what this even means, but I'm absorbing information. There's my medical orders. I'm going to need to think about lab services. I'm going to need to be thinking about communications. We often forget about the importance of communications, especially in the response. We know that's the number one item that gets documented always in our after action report. So be thinking about communication, internal and external. I'm going to have to think about documentation. You know, what are some of the forms I'm going to need to complete? What about my medical records? Floor plans. Okay, so I'm going to be thinking about, you know, how I'm going to implement testing in my facility. Is it going to be in the living room, in the dining room? What's the layout going to look like? How do I ensure the safety of both my residents and staff? And then I've got some information regarding the day of the testing. So working with the swabbing team and what my responsibilities at minimum would be in regards to working with the swabbing team. And then lastly, what to do after testing. So after testing, I'm going to be needing to think about reporting and documentation again. And then floor plans. And really thinking about, once we get testing results and we find out we have positive residents, how are we going to then mobilize them and ensure that they are, you know, safe in their environment, but then also keeping our staff and residents safe and mitigating cross-contamination. So that's what attachment 1 really outlines, and it becomes really handy for that administrator to just hand over to the testing team lead to get started as a launching point. Is that checklist exclusive and totally exhaustive? Absolutely not. Again, thinking about this is a tool, this is a framework. So what you'll find is that you'll probably add to that checklist. You may very well take off things from that checklist, depending on the model you decide to move forward with, will inform your checklist. This checklist is also meant to be used with every infectious disease response. So you might have a checklist today for COVID, and you can just tuck that away after COVID is done. You'll get a fresh new checklist for the next time around, for the next disaster, infectious disease response, and modify it based on that infectious disease. Again, scalability is key here. Okay, so let's just toggle back to our PowerPoint, because I want to make sure that I cover the aspects that are being documented in the slides here. So we talked about the threat assessment and remembering that for COVID, everyone is at high risk. We talked about activation. So although the only area that was needing your attention to write out was to identify who would be responsible to activate the plan and then appoint a testing team lead, I encourage you to be thinking about what are the triggers that are going to activate my plan and document those there. Are we going to solely wait for the state to tell us to activate? You know, I would hope that you would also be mindful of the fact that you might choose to activate testing earlier before it becomes a mandate or a requirement. Again, just based on the makeup of your community and your facility. And then thinking about what are some additional steps that might be taken upon activation. You might consider activating other plans. So if you're in the thick of a response, you're definitely going to be activating a communications plan as an example. But in light of a testing plan, how might that differ with your communications plan? Will there be an extra section in there that's specific to testing that you will want to activate? Another example would be staff leave policy. So you all have staff leave policy and vacation policy in place at your facilities. But during a disaster, and especially during key aspects like testing, are there nuances in those plans that you're going to want to document and then have ready for activation once a testing plan, once the testing plan has been activated? Those are the kinds of things to think about for activation. Excellent. So let's talk about operational considerations. So again, now we're starting to really get into the nuts and bolts of your plan, and you're thinking about process here. You're thinking about, how am I going to secure medical orders? How am I going to secure lab services? What is my specimen collection model going to look like? And what are the testing resources and supplies that I'm going to need in order to successfully execute this effort? So medical orders. So here we're going to talk about, your internal process. What are your resources locally and regionally, and what are your state resources? So let's think about local. So, or I'm sorry, let's think about internal. Let's start there. So you are a facility that has access to a medical director. And so you're going to want to ensure that you leverage that resource right there. That is the most easiest, most sustainable, long-term approach that you can take. But then you're a facility that doesn't have access to a medical director in-house. But you know that you have a facility, a neighboring facility that does, and you reach out to them and you ask if that medical provider would be willing to sign medical orders for your staff and residents. And they do, and they're willing. Great. So let's leverage that resource. Let's document that, and we'll go to the plan template so you can see where we're going to document. What about a medical provider at a local hospital that you have a very close relationship with, and there's a provider there that you have an established relationship and that would be willing to be your provider to sign medical orders? That would be another sustainable approach, because again, it's all about those relationships and having those existing operational structures in place. Always start locally. Always think about, what are my normal operating procedures? If this were any other response need that I would have to get medical orders from, where would I turn to initially? But then let's say that, you say, Angie, I don't have any other resources. I don't have someone in-house. I don't have someone locally. I don't really have anyone else to reach out to. So you go to the third tier, and that is state resources. And at this time, we have the infrastructure in place in case you need assistance with accessing medical orders to be written for you and your staff and residents. And so we'll talk about how you go about requesting that process. But again, knowing that you have a safety net at this point in time, it's just a matter of thinking through what are the best approaches to take, and more importantly, what are the sustainable approaches to take? Because again, this is long-term in regards to this response. We don't really know when that end date will come. But I'm also going to put that caveat that this testing plan, again, is not just for COVID. It is really meant to be for all infectious diseases. So being able to be flexible and have some of these core functions in place for that next disaster. As you are thinking about your medical orders, be thinking about, do the processes differ between staff and residents? So when I request assistance for medical orders to be written for my residents, will that process be different for staff? And we'll talk about that as we dig into the template. So let's talk about lab services. Same thought process here. You're going to think locally first and move up then to the state. So what existing lab partnerships and agreements do you have in place? And are they equipped and willing to process the specimen collection that you have from your testing date? One caveat here will be if you decide to go down the route of contracting with a mobile testing or swabbing team of any kind, and we'll talk about the different kinds that you might have, you'll want to ask them, do they have lab services as part of their package? Because most would have something, especially if they are in an organization, an entity that this is a product, a service that they provide. They would have those means there. Specimen collection is that third section. So here we're going to be talking about who is going to collect the specimen in your facility. Do you have staff that would be qualified to be able to collect the specimen? Or do you have staff that could be trained to collect specimen, but just don't know how to do that right now? But maybe if they had some just-in-time training, they can then take it over after the fact. You might also be thinking about, what about locally? Do I have a fellow long-term care facility down the street that can be, we can go into a buddy system, and they have staff that they can lend us to swab our staff and residents, as long as we provide the supplies and the lab services and the medical orders. They're more than willing to do the swabbing. Fantastic. Leverage that resource, leverage those relationships. Great. And then we'll talk about at the state level. So if you get to the point where you're like, again, Angie, I don't have any resources, you're kind of out of ideas. Not a problem. As I mentioned before, we're all in this together, and the state EOC has state contracted mobile swabbing teams available at your request for assistance. So more details to come as we dig into the document. The last section before toggling over is that of testing resources and supplies. So here we are going to be looking at very specifically the logistics that you are going to be needing for securing supplies. So if you are doing testing in-house, so on your own, with your own team, or with a neighboring partner that is going to come out and do the swab for you, as long as you have supplies, you're going to want to know what you need to have on hand, what supplies lists, shopping lists do you need, right? You're going to want to ensure that you follow your normal supply chain. You'll want to also have an understanding in regards to your responsibilities if you go the route of a contracting mobile swabbing team. So, most swabbing teams that are providing that as a service come with their own supplies, but you'll want to, and we have an attachment and a checklist as well. You'll want to confirm with them and ensure that you are not responsible for anything. And if you are, that you know exactly what you need. All right, great. So let's move on over to the documents. Okay, so medical orders. So we gave those examples, and they're the same examples on your guidance document as well. So right here on the left-hand side, talking about within your facility, talking about a relationship locally or regionally. Another example is that, some facilities have partnered with their local public health, and they have that relationship. What the key point here being that every community is different. And so I can't tell you, for example, I can't tell you all of the different resources at the community level. Everyone is so unique, and it changes. It's so fluid. So reach out to local public health, reach out to your healthcare coalition, reach out to your peers within the community and ask, how are they going forward with securing medical orders? So in the template, though, what I want to point out here is that we have a section that has been divided up between resident strategy and staffing strategy. So what is the process you're going to take with obtaining medical orders for your residents and enter that information? And what is the process for your staff obtaining medical orders? And the reason why we do this is because we're trying to be very deliberate about ensuring that you have thought through, will it be different? And if so, what are my instructions? What are the expectations? What are the steps that have to be taken? And if it's going to be all the same, then perfect. Go ahead and say residents and staff, pair it up together and call it a day. Now, the additional piece that is included in this section is the definition of staff. So we indicate here staff will include who. So who are you going to cover with obtaining medical orders in regards to your staff? Are you covering all staff? Are you covering only full-time staff? Are you going to treat volunteers any differently, or any of the other individuals within your facility? Take the time to think through who is going to be part of this overarching umbrella of medical orders that you have obtained on behalf of your staff. Okay, great. So once that has been identified, then as you saw, if you recall on attachment 1, you would complete that out and indicate who. And we've got a sample verbiage here on who that is, what their number is, what they're willing to do, etc. Okay, lab service, again, very similar, but the things I want to point out here is you would indicate what is the information pertinent to the lab, who that is, what's that established relationship, what are they willing to do, what are the roles and responsibilities, etc. But what I want to point out is attachment 2 is the lab worksheet. And again, with every response, this worksheet would be updated. And it's possible you might have multiple versions of this worksheet even within a response, because things do change. And that is also the name of the game with response, is the level and need of having flexibility. So with this lab worksheet, you would have information captured regarding the lab, the point of contact, the phone number, what sort of swabs are required for this lab. That becomes really important because labs have their own processing specimens, and you want to make sure that the swabbing media that you have is appropriate and acceptable for this lab. And then you're going to want to indicate any pickup or delivery instructions on behalf of what the lab has stated. The next section is all about dates, date of sample collection, date submission, the date results were received, which leads us to the following section. And this is where it's going to be key for you to have the data on the number of samples processed, what are the number of positive staff and positive residents, and were there any inconclusive samples and how many? And the point being here is that you want to have a source of truth. So with every testing that has been implemented, every testing cycle that you enter and complete, you want to make sure that you have a running list of the data. Now, if you are filling this document out, this plan out for multiple facilities, you might find that you want to have a spreadsheet. Not a problem. Take the nuggets of this checklist and transfer it over to whatever means of data collection is appropriate for you. And then we've got specific lab labeling requirements. So you'll get instructions on how to label your vials and what you need to do, etc. Now, One key component, one caveat, and it's in both in the template and in the guidance, and that is if you decide to go down the route of contracting a swabbing team, you'll once again, you'll want to ensure that you connect with the team point of contact and ask what lab services do they provide as part of their package that they are, providing you as part of their services. So, and if they say, yep, we have lab services, and you'll need to connect with so and so, document that and move forward with reaching out to them and confirm with that lab, as an external partner, as a third party, confirm that you have all the information you need. I would not make any assumptions. I would do all you can to be as detailed and diligent as possible here. Now, one thing to point out, and it's indicated here on the guidance side on the left-hand side, is that you can request lab assignments through the state EOC. So if you are, if you decide to do testing on your own in-house and you need a lab to process your specimens, then feel free to reach out through the REDCap survey that you all are comfortable with now for requesting assistance for testing, and indicate there that you would like assistance with lab services as well. Okay, so again, that's that redundancy that we've put in place to ensure that you have all the necessary means possible to fully implement testing and be successful at it. We want nothing more than for you to be successful now and in the future and ongoingly. The third section is that specimen collection. So now we're talking about how are you going to collect that specimen. So we talked about the different ways to go about it. And here you're going to write it out. So you can see it's only a sentence here. And that's deliberate because we want you to take your model and beef up this section. Outline who's going to do it. Is it a team? Is it one person? Is it internal? Is it an external partner? Is it a contracted team? And then are there any specifications that you need to be mindful of, that you need to document? Is the collection going to be different between residents and staff for whatever reason? Things like that. And we're going to dig deeper into some of the nuances. But this section here is all about what direction, what path are you going to take when it comes to specimen collection. Okay, the last section in this operational bucket, if you will, is testing resources or testing supplies. And as I mentioned, it's all about the details. What are the supplies you're going to need? This section does refer to another worksheet. So we're going to go and jump to that worksheet because here's where you're really going to fill out the nitty gritty. So again, data on numbers of staff and residents. But then you're going to want to be thinking about specimen collection items. So what are your responsibilities for specimen collection? If you do this on your own, if you conduct the swabbing on your own, and you find out that your lab, for instance, is not going to provide specimen collection media, then you'll want to ensure you have that and that you have plenty of it to cover all of the different testing cycles you may be doing. If you're working with the state contracted lab, as an example, they're going to be supplying the specimen collection for you. So you'll want to document that here. If you decide that you are going to, need to set up for the swabbing team, and you need to make sure that there are tables and chairs and other details in place, this is where you're going to write it out in this second line here, the second row. So you not only have the specimen supplies themselves, but then what about the infrastructure supplies? How do I ensure that the flow is effective and that my swabbers and anyone providing intake and registration have the tools and supplies that they need. Do you have containers for your specimens? Do you have ice packs and coolers? How about space? Do you have space in the refrigerator to hold your specimens until they get picked up? So those are some of the things to write, but then we would be remiss if we did not talk about PPE. PPE supplies are so important to ensure that you understand what your responsibilities are when it comes to supplying PPE for the swabbing team. So if your staff or you have staff coming in from, let's say, a fellow long-term care facility in the community, you'll want to ask, are you supplying PPE for your staff that are going to be swabbing? And if not, then is that my responsibility as a facility? And if so, you'll want to get the details you need to ensure that you have those resources. If you're working with a contracted mobile swabbing team, most often they will come with their own supplies. But again, I wouldn't make any assumptions. Ask them, specifically call it out. Will your staff have the PPE that is needed, or do you need me to provide any? Now, some of the questions that have come up in the other webinars have been, what about requesting PPE assistance through REDCap? And remembering that that is still a viable option. If you are at a point where you are not able to provide adequate PPE supplies to your swabbing team because you're running low, then by all means put in a request for your PPE REDCap survey and ensure your coalition is aware so that they can assist you with addressing that need. And then, of course, as always, a section for additional comments for you to consider any other specifications that may be required. All right, so I'm hoping you're starting to see that you have the foundation laid, you have policies that you've identified, you have now determined kind of the approach you're going to take and who are the different partners involved, what are the different services that are being provided. And so we start to move into some additional buckets of categories. And the next one here is testing requirements. So testing requirements, as I mentioned, was having to do with, what are the guidelines and the guidance being put forth by the state and the CDC in regards to testing. So every disease will be different. We know that. And so we know right now with COVID, there are very specific testing requirements that need to be in place. And so this is where, again, we make the assumption that you know how to access that information and that you need to be informed of that information. And so what we recommend here in this section is indicating what are any of the potential requirements that need to be in place, whether it's additional isolation or cohorting measures, etc. So a small section that would be needing your attention. Most of this is kind of, standard information that can stay, but really thinking through what specifically due to this response is important to capture in regards to testing requirements. Great. So we're going to move on to testing approach. Now, testing approach is all around, how am I going to go about and make sure that, once I've determined my model, how do I execute that? And that's where the approach, the strategy, if you will, comes into play. Okay, so on the left-hand side, we look at some ideas, some considerations. And so from a specimen collection, for instance, are you going to collect the specimens within the resident's room? Are you going to have everyone come to a centralized location? Are you thinking about testing all at once, or are you going to space it out throughout the day? Are you going to do it once a week versus once every other week versus once a month. Those are the kinds of considerations you want to be thinking about as you complete this testing approach. And then we once again come back to what are the nuances between the approach of testing your residents versus testing your staff. Are there any? And if they are, please write them down. Now's the time to write as much detail as possible, because when the time comes for you to implement your testing plan, you want to make sure that you don't have to second guess. You don't have to expend extra brain power, because you're already exhausted and in the midst of stress and chaos. So you want to take the time now to fill out as much of that information as possible. All right. So we've talked about, how I'm going to go about moving forward with testing and, that approach, that model. But now during implementation, now I've come to the day and I'm implementing our testing plan, and I'm more realistically knowing the fact that I'm going to come across some barriers. I'm gonna have some bumps in the road. And so thinking through prior to testing, thinking about what are some of those potential bumps in the road. I might have a resident refuse to be tested. How do I go about dealing with that? What's my action? What are my communication requirements? Who am I going to contact about that? And how am I going to solve this refusal? Or am I going to solve this refusal? Like, maybe I'm not going to take any action. And I'm taking this information from the guidance here on the left-hand side. Thinking about staff refusal. What about if staff fail to show up for testing on the day of testing? Or what if they're out sick? Do you have another testing date in place and already lined up as a backup? And what about in regards to the lab? What if they're unable to process a test? Do you retest? Do you just wait until the next round? What's going to be your policy around all of these what ifs for testing implementation? Those are the kinds of things we want you to be thinking about and just document. All right, let's move into reporting, and then we will move into the last few sections here. So reporting is all about the expectation that has been set forth by the state and federal leaders. What are your reporting requirements? We know we have reporting requirements with any of these responses. So you'll want to make sure that you outline what those are. And as if you recall back in attachment 1 for that testing team lead, and we talked about reporting was in place, that would be a great time to review that again and look at what are some thoughts to consider. Now, in addition to just reporting to the state and federal partners, you'll want to be thinking about, what are my reporting processes internally? How am I going to ensure that I've documented the results within the medical records, as an example? Who's going to be responsible to do that? Who will be responsible to receive the reporting, the results of the tests? Normally, the providing physician who signed the medical orders receives the results, but sometimes they've delegated that to the director of nursing. Is that going to be the case for your facility? So once you've identified who will receive it, then identify how it will be received. And that's all here in this section. I'm just walking through what this section is asking you to consider. So how will you receive this information? Will it be via a phone call? Will it be an email? Will it be, a letter? How will that be received? And then, of course, how will you take it to the next level and inform the resident and the staff and the resident representatives of the results? how will you go about in implementing your communication plan as far as that is concerned? Will you follow through with a letter or a call? You know, how will that pan out for your facility? So be thinking about that. There is also some information on our MDH website regarding refusals. So highly recommend to check that information out. Great. So let's move on to cost. You see on the right-hand side on the template that cost is pretty slim. And that is done purposefully because on the left-hand side in the guidance, cost is pretty detailed out in regards to considerations. The bottom line with cost is leveraging any resources you have available to you. We want to maximize all of our resources. We want to ensure that we are leveraging all of the potential reimbursement options that we have. Because no one facility, no one agency organization can take on 100% of the cost indefinitely. And so we need to think about what is the most sustainable long-term approach. And that's the way I'm going to approach this section is think of it from a business perspective. We know that testing is going to be an ongoing effort. So because of that, we want to ensure that we are thinking through what are my resources right off the bat. The first thing to be thinking about is insurance. So what are my options for billing insurance? And document that process here. So that's tier 1. And then tier 2 is, what about the responsibilities of the staff and the residents with testing? Are they going to be responsible for any cost incurred? Only you can answer that at this point. Again, this plan comes down to you as decision makers making those decisions regarding your facility. You have guidance that has been set forth. You have requirements that have been set forth, but the plan itself and how you execute that is yours. And so what are the steps that you're going to do to achieve that? One thing to point out is that some of you have access to other reimbursement means. So like, for instance, if you're a skilled nursing facility, you have access to a reimbursement through Department of Human Services, DHS. And so we've indicated some of that information here for you to reference. If you have any additional questions, feel free to reach out and we can connect you with the right individual. I highly recommend connecting with your peers. How are they going about with the cost aspect? How are they going to budget for this? In the previous webinars, we've been talking about, thinking through from that business lens. If I know this is long-term and I know eventually I might need to pay for some of this, because we have no magic ball. We have no idea what the future holds. So as a facility administrator, I want to ensure that the utmost safety for my staff and residents. And in order to do that, testing is one of those key aspects. So because of that, I want to budget for it. I want to start putting some money aside as a general operating budget line item. And if I tap into it, then at least I have that reassurance that there's some money there. If I don't need to tap into it, then that's bonus. Then that money can be reallocated elsewhere. But at least you've started to identify a sustainable and redundant measure for addressing cost. Now, specific to the state, as I've mentioned throughout the webinar, we have state resources for you. And at this time, those state resources do not incur costs for you. So if you access and leverage a state contracted swabbing team, the state will bill the insurance just like you would, and then cover the remaining bill. If you access the lab, the same will happen. You know, we bill insurance and cover the remaining balance. So every one of us as leaders need to be thinking about, okay, so what is my short and long-term strategy going to be? And you might find that you might want to do a little bit of mix and matching. So maybe my short-term strategy is that I'm going to, you know, leverage the resources I have available. I am going to get trained by a state contracted swabbing team. That's going to get covered for this first round. Lab is going to be covered for this first round. And then the next round, my staff is trained. So that's not really going to cost me anything other than time of my staff. But at least now I'm able to maximize and have a little more control over my schedule of when testing is being conducted. And I need just assistance with lab. Okay, great. Now you've scaled down the cost there. So you're just focusing on lab. And then maybe down the line, you have an existing established relationship with your local lab partner. And the rates are reasonable and within your budget. And so, you know, a year from now, if you're still having to test or whatever that timeline is, and you're still having to test, you know that you have addressed a sustainable approach. Without that being said, all of this information being said, I want to reassure you that we at the state are going to do and continue to do all within our means to provide the services that you need to be, again, most successful and safe when it comes to this to the disease that we're facing here. So at any given time, please reach out to our SCOC testing team. The email is located within the guidance in multiple areas, and ask about the available resources. So I hope that sheds light on how you can approach cost, because we know that has been a key component for us as we've been planning. And then lastly is planned maintenance. And of course, planned maintenance is all about how often you're going to update your plan. Okay, great. So we're going to toggle back and just briefly go through the recap. So we talked about testing approach. And again, that's all about the direction that you're going to be taking once you've determined the model you've got. So there's some considerations here. We have the implementation of your testing and what you're going to do during the implementation of that day, and what are the different plans that intersect, and what are the what ifs that you're going to be considering in regards to which plan to activate or what policy you might need to write. So those aspects are there. And then we talked about reporting, and really looking at what are my responsibilities for reporting, state and federally speaking. What is the process that I need to take in order to track everything and maintain updated records? You know, how am I going to share this information? Who is going to share it, and with whom are we going to share it with? So thinking through all those aspects of reporting and tracking. And then, of course, we spent time talking about cost and how we really need to be mindful and strategic about finding that balance with a sustainable approach to addressing cost. And knowing that at the end of the day, if any questions or concerns, that we at the state are more than happy to assist and talk through what are the different options, how we best can help you, and ensure that cost does not become a barrier for moving forward. And that's really what we want to ensure, that the message is loud and clear on. Plan maintenance. So again, reviewing your plan. I highly recommend that once COVID is done and we're all taking a deep breath and stepping back from the response and engaging in our after action reports. Once you've completed your after action reports and identified in your process improvement, come back to your plan and update your plan so that it's ready to go with the next infectious disease disaster. So with that, here's my information. I'm more than happy to answer any questions. Again, I highly recommend that you connect with your healthcare coalitions and work with them, work with your local long-term care peers. Everyone right now statewide is working on a testing plan, or at least I'm hoping they are, because again, that is the expectation, to have a plan in place and to start forward with testing. But I also recognize, and we also recognize, that everyone is at different levels of readiness. So if you haven't even touched it and this is your first time thinking about it, then kudos to you for taking that first step, and know that you have access to all of us for assistance. If you have a plan in place, I hope that you're able to cross-reference your plan with the sections that we have in our plan, and add any sections that are missing to your plan, and ensure that you have all of the nuggets that are needed to make sure that your plan is as robust as possible. Lastly, all of these documents, the testing plan and the guidance document, are on our state website. So I am going to just go back and go into our website. And so we're going to go ahead and go to health.state.mn.us. So health.state.mn.us. And you will go to Healthy Communities, Environment, and Workplaces. And you will scroll down to Emergency Preparedness and Response. And you will go to Long-Term Care Preparedness. And this is where we have long-term care preparedness. This is our landing page. Many of you have worked with the resources here. You probably recognize the Preparedness and Response Toolkit that has helped you develop your EOPs. But at the top of this page is where you'll find the template itself for testing and the guidance for testing. You'll also find the staffing contingency plan template and guidance and webinar as well. So that is where you'll be able to find all this information. Thank you so much for the opportunity to connect with you. Again, if you have any questions or concerns, do not hesitate to reach out. And thank you so very much for the ongoing efforts around the clock, 7 days a week, that you provide on responding to our COVID-19 response today. It is amazing to see the amount of work that's being done, the growth that's been done across the facilities, and ensuring processes are in place and that their staff and residents are in a safe environment, and addressing when you do have positive cases, being able to become resilient with addressing those efforts. So thank you so much on behalf of all of the preparedness partners across the state. Have a wonderful day. Bye-bye.